we're going to dive into something a little controversial in Wheeling, West Virginia. We're talking about the opioid crisis, and the settlement funds that are supposed to help. And it seems like there are some questions about where that money is actually going.
Yeah.
We've got a whole stack of articles from the Wheeling News Register.
Okay.
And it looks like people are pretty fired up about how the police department is using these funds.
Well, you know, this is kind of a microcosm of what's happening all over the country, right? This whole question of like, are we tackling this from a law enforcement perspective?
Right.
Or were we looking at it as a public health issue? And Wheeling is a good example of that.
Yeah, it seems like the Wheeling Police Department and Chief Schwartfeger are saying that they've had some success in bringing down the overdose numbers.
Yeah.
And they're defending how they're using this money.
Right.
They're using it to fund this Special Crisis Response Unit.
Yeah.
Or the CRU.
The CRU. Yeah, and there's a lot of pushback from people who are saying, wait a minute, this money should be going to treatment and prevention programs. It shouldn't be going to law enforcement. And then some of the details are like raising some eyebrows. Like, they bought ATVs.
Oh, really?
With this money, and they operate strictly within city limits where all the roads are paved.
So ATVs, I mean, that's interesting just from the optics of it all.
Yeah.
But does that even make sense practically?
Yeah, that's what critics are saying, is like, this just seems like a weird use of the funds. Give it to the healthcare professionals. Give it to addiction specialists.
Okay, so let's kind of unpack the police department side of this first.
Okay.
I'm looking at this article from January 14th, where they explain why they're doing this.
Okay.
And they're saying that this CRU is a key initiative. It's operating 204/7. They've got these peer recovery specialists and a victim advocate.
Right.
And they're saying that they're even going to add a social worker to the team.
Okay.
And they're pushing this idea of like immediate access to support, especially when it's really late at night and some of those other services might not be available.
When everything's closed down.
Right, exactly.
Okay.
And they say they've got a 37% reduction in overdoses.
Wow.
In 2024.
Okay.
So they're saying that this is proof that their approach is working. And Chief Schwartfeger even said, this is a quote, anyone that wants to dispute why the funding should not come to a police agency, they need to hear these numbers.
Oh, wow.
He's really putting a lot of weight on those numbers.
He is.
You know,
it is interesting, like how he's using those. I mean, obviously, any reduction in overdose numbers is good.
Right. Of course.
But we have to look at the bigger picture here. This is West Virginia. I mean, this is a state that has been absolutely devastated by the opioid epidemic for years.
Yeah, there's another article here from January 31st. It says that West Virginia had the highest opioid overdose rate in the nation back in 2022.
Oh, geez.
So is this 37% reduction really as good as they're making it sound?
Yeah, exactly. That's the question. You know, is this because of the CRU?
Right.
Or is this, you know, just a little blip in a much larger and much more tragic trend?
Right.
You know, so you have to look at these numbers in context.
Yeah, and this is where this whole debate about law enforcement's role in a public health crisis comes in.
Yeah, exactly. So, you know, the police department is saying, hey, we're here. We're responding immediately. We've got the CRU. But the critics are saying, no, the real solutions, the lasting solutions, are going to come from focusing on treatment and prevention.
But wouldn't it be helpful to have the police readily available if someone's overdosing?
I mean, it seems logical on the surface, but you got to think about it.
Yeah.
Someone's overdosing, and people are afraid to call 911, because they don't want to get like wrapped up in the legal system.
So even if they're trying to get this person help, they might end up in trouble themselves.
Right, yeah.
Okay.
And that fear is very real, especially when you think about West Virginia's overdose rate and their incarceration rates. It's all kind of tied together. And actually, the article that we were just talking about, the one from January 31st, it points out that in 2022, West Virginia had one of the highest incarceration rates for people who had opioid dependency.
Wow.
And, you know, at the beginning of 2023, the recidivism rate was 24%.
24%. So even if they get out,
they end up right back in.
They're likely to go right back.
It's like this vicious cycle. And so the critics are saying, look, this fear of prosecution is actually making Chief Schwartfeger's CRU less effective.
Okay.
Because people are saying, I'd rather risk dying than risk getting in trouble with the law.
So it's like what they're doing is working against them. Yeah. Even if they have good intentions.
Yeah, it's really complicated.
It is really complicated.
It is. And it really makes you think, like, how do you build trust with a community that has been so impacted, both by the opioid crisis and by the criminal justice system?
It's like they're trying to solve a public health crisis with law enforcement.
Right.
And those two things just don't really seem to go together in this case.
And that's really what's at the heart of it. The critics are saying this money should be going toward things like amnesty programs, decriminalization, guaranteed immunity for anyone who calls for help during an overdose.
So you're basically saying that instead of having the police there as the first responders in these situations, we should have healthcare workers.
Yes.
We should have these addiction specialists.
That's the idea, like recognizing that this is a health issue. It's not a criminal issue.
Right. Okay. And, it makes you wonder, like, are the police even equipped to handle something like this?
I mean, responding to an overdose.
Yeah, it's not like responding to a crime.
It's not like responding to a crime.
And that's something that they talk about in one of these articles, is that, addiction specialists are saying, look, police officers, they don't have the training.
Right.
They don't have the knowledge to really deal with this.
So, even if they mean well, they might not be the right people to be there.
Yeah. And maybe their presence is actually stopping people from calling in the first place.
It's like this chilling effect.
Right. And it could be deadly.
Right. Okay. But Chief Schwertfeger is saying that this CRU is making a difference. And he specifically mentions
this 24-hour coverage, that they're different from other programs because they're 24 hours.
Well, and I thought that quote was interesting, too, because he says, there are some programs out there that are wonderful, the difference being that we provide 24-hour coverage.
Oh, wow.
It's almost like he's acknowledging that there are these other programs that may be more effective. Right. He's saying, well, we're here 24/7.
Right. Okay. But wouldn't those other programs be more sustainable long term?
Yeah.
Because they're like actually addressing.
Right. They're dealing with the root causes.
The root cause.
Rather than just the symptom.
Right. Okay.
And that's what these critics are arguing, is like, invest in treatment centers, invest in mental health services, invest in prevention.
So then what about these ATVs?
Yeah.
I still don't understand. I mean, they're a city police department.
Yeah. Why do they need off-road vehicles? I mean, it just doesn't make a lot of practical sense. And it just feeds into this narrative, right? That they're like prioritizing equipment over actually dealing with the needs of the community.
Yeah. And, it's not just the ATVs. This January 31st article also mentions these police bonuses that are being paid out of the settlement money, too, on top of this new $6.5 million police building they just got last year.
Oh, wow. So you have to wonder, like, what are the priorities here? Yeah. Is this money really going where it needs to go?
It just seems tone deaf, with all the struggles people are going through in Wheeling.
Right. And this kind of brings us to another layer to this whole thing, which is the Wheeling City Council.
Okay, yeah.
They've been getting a lot of criticism for how they've handled this money.
Like the fact that they just gave all this money to the police department without any kind of application process.
Right. There was no transparency. Yeah. And one community member actually said, this is in the January 31st article, they said, almost $500,000, and the city council didn't even enact an application process. How could this happen?
Yeah, that's a good question. It feels like there should have been more community involvement, more transparency.
Yeah, it just feels like there's like a lack of trust.
Yeah.
Like they're just prioritizing the police over everyone else.
Right. And it's like they're not listening to the people who are actually going through this.
Yeah, it just makes you wonder, who benefits from all this? Is it the community or is it like these institutions?
Yeah. I was thinking about something else Chief Schwertfeger said. He kind of dismissed those concerns about the police maybe misusing their equipment. Yeah. He basically called it like silliness.
Yeah, and I thought that was really troubling, that kind of dismissive attitude.
Yeah, it's like he doesn't really see a need to address these concerns at all.
Right, like we know what we're doing.
Right, and it kind of highlights that power balance we were just talking about.
Yeah, exactly. And there's another thing I wanted to mention. Remember how we talked about
Oh, yeah.
Money coming from the West Virginia First Foundation.
Yeah, he said, don't worry, there's going to be more money available.
Yeah. And like that raises some red flags for me. I mean, first of all, that's assuming that there's going to be more money.
Yeah, exactly.
And second of all, it just completely ignores how urgent this is.
Right. People need help now.
Right now. They can't wait for some, maybe money.
This is a life or death situation.
Exactly.
And all of this just keeps bringing me back to this question of how are we even thinking about the opioid crisis? Mm-hmm. Is it a criminal justice issue?
Yeah.
Is it a public health crisis?
Right, because how we answer that question really determines how we try to solve it.
So let's say it is a public health crisis. So, what does that look like?
Well, I mean, we've already talked about some of the solutions, right?
Yeah.
Expanding access to treatment, mental health services, harm reduction strategies.
But those are all like long-term?
Yeah.
What about right now?
Well, that's where models like the CRU come in. Yeah. But, I think the big difference is that you would have like real partnerships with healthcare providers, with addiction specialists. You'd be creating this response that focuses on care, not punishment.
So instead of sending police officers to an overdose,
you send someone who can like administer naloxone and then get that person into some kind of treatment.
Okay, that makes sense.
Yeah.
So, I mean, it's pretty clear that what's happening in Wheeling is really complicated.
It is.
There's a lot of back and forth.
It's messy.
But at the end of the day, this is about people's lives.
That's right. It's about helping people and communities heal from this horrible crisis.
And I think it also requires us to really challenge how we think about things.
Absolutely.
To keep our leaders accountable.
Yeah. And to realize that this is a multifaceted problem that needs a multifaceted solution.
Well, I hope this has given everyone listening a lot to think about.
Yeah.
Maybe you've been surprised by some of this. Maybe you're thinking about your own community and how they're dealing with this.
Are there similar problems? Are there opportunities to get involved, to speak up for solutions that are focused on treatment and prevention?
And, we want to encourage everyone to keep thinking about this, keep exploring these issues.
Yeah, because ultimately, the opioid crisis is a problem for everyone.
Yeah.
And it's going to take all of us to solve it.
Exactly.
Yeah.